Washington. Alex M. Azar II, President Trump's nominee for Secretary of Health and Human Services, said Wednesday that he would try to reduce the burden of high drug costs, but he largely absolved drug companies from blame, placing the responsibility on a system that encourages price increases on medicines. Mr. Azar sailed through the first of two hearings on his nomination without making major missteps. But he did not appear to dispel the doubts of Democrats who distrust him because of his experience as a top executive at a major drug maker, Eli Lilly and Company, for 10 years. Democrats said that Mr. Azar had enriched himself in going from government to private industry and was potentially tainted by his work in the sector. One Republican, Senator Rand Paul of Kentucky, joined that chorus. "You've got some convincing to make me believe that you're going to represent the American people and not Big Pharma," he told Mr. Azar. Mr. Azar's first confirmation hearing came 2 months after Tom Price resigned as health secretary in the face of multiple federal inquiries into his use of private and government planes for travel. Mr. Azar has ample policy experience, including a stint as deputy health secretary under President George W. Bush. But he would assume control of the Department of Health and Human Services at a sensitive time. Healthcare.gov and the Affordable Care Act are in the middle of the first open enrollment period of the Trump era, and Mr. Azar's background in the pharmaceutical industry is raising questions about the president's campaign promise to bring down the cost of prescription drugs, by allowing the government to negotiate drug prices for Medicare and possibly permitting the importation of medicine from Canada. Mr. Azar pledged that if confirmed, he would work in the interests of all Americans, not in the interests of any trade group, not in the interests of any company. He added, "This is the most important job I will ever have in my lifetime." He said he wanted to maximize the number of Americans with health insurance, but he supported Republican efforts to repeal the Affordable Care Act's requirement that people have coverage or pay a penalty. And he disputed Democrats' assertions that Mr. Trump had tried to undermine or sabotage the 2010 law. "What I do not support is forcing 6.7 million Americans to pay $3 billion of penalties to not buy something they don't want to buy through a mandate upon them, 90% of whom make $75,000 a year or less," Mr. Azar said. As a top health official in the Bush years, Mr. Azar helped carry out a 2003 law that provided drug benefits to millions of older Americans through a program known as Part D of Medicare. He joined Lilly in 2007 and stepped down as the president of Lilly USA in January. Senator Lamar Alexander, Republican of Tennessee, who presided over the hearing as the chairman of the Committee on Health, Education, Labor and Pensions, said Wednesday that Mr. Azar's experience in the industry would help him improve the Byzantine arrangements under which drugs are priced and distributed. "Drug prices are too high," Mr.